I'm Jennifer McKee, an integrative nutrition health coach and founder of McKee Health Transformations. And I've lost 185 pounds naturally, no surgery, no shakes, no diet pills, no nothing, just by making healthy habit changes to my nutrition and mainly to my mindset. Learning how to not let my negative inner critic control my life. And I also had to eliminate all or nothing thinking and get a handle on that. At the end of my journey, I was doing really great, but then I started getting digestive issues and I started noticing terrible abdominal cramps. This may be TMI, but gas and just not feeling normal. And it did not feel like regular upset stomach. It felt different. And so that's when I sought Dr. Emily Park, who is here with us today, a functional medicine doctor, and to get some advice on that. And that's when I found out that I had something called Sibo. So I've been trying to treat Sibo now for almost a year. I think I've probably had it for at least 2.5 years without realizing what it was. I thought it was a food sensitivity. So I had tried tons of different elimination diets, but I still had the same symptoms, which is another reason I knew it was something different. And my symptoms would always happen starting in the afternoon, like after my body had had a chance to digest some food. That's when the issues started happening. I rarely wake up with any SIBO symptoms. So what I want to interview Dr. Emily Park today to talk about what functional medicine is, but also talk about SIBO, because a lot of people out there are not educated about SIBO, unfortunately. And to my surprise, there's a lot of people out there who do have SIBO. I didn't realize it was so widespread. So we're going to talk about that today. So welcome, Dr. Park. Thank you so much for taking the time to do this. Why don't you give us a little bit of background about yourself, your qualifications, and also what a functional medicine doctor is?
Sure. So awesome, Jen. Thank you so much for having me too. Thanks for your time also. But yeah, no, this is great. So functional medicine is all about finding and treating the root causes of whatever signs and symptoms are going on. So that's a little bit different than the traditional medicine approach. And I did go to traditional medical school, internship, residency, fellowship. So I have all of that training. And then I got trained in functional medicine. So I, understand both ways of thinking very well. And in traditional medicine, unfortunately, the way it works is, oh, you have a symptom. Here is the pill or the procedure we have for you. The root cause thinking, like the how did you get there, the why, or more commonly whys, because most of the time there's multiple root causes behind how you're feeling now. That method of thinking is just unfortunately completely, missing and devoid from, traditional medicine training. So in functional medicine, we are the detectives. We really want to get to the bottom of all of the root causes, because if you never get to the bottom of it, you may feel better temporarily, but it's nothing more than a band-aid. And until you really fix the root causes, you're going to struggle with your health.
I couldn't have I said anything better than that. That's amazing. That's exactly right. And that's why I sought a functional medicine doctor to help me with, the issues that I was having. So great. So why don't we talk now, what is SIBO? What does it stand for and what are the symptoms? I know I talked a little bit about my symptoms, but I know that there's some other symptoms as well.
Totally. So SIBO stands for Small Intestinal Bacterial Overgrowth. So it's bacteria that's overgrown in the small intestine. And just to let you know a little bit about the small intestine is several feet long. So, just a quick little anatomy lesson, right? When you eat your food, digestion begins in the mouth, right? Then it goes down you swallow, goes down into the esophagus, then it hits the stomach where acid starts, churning. This will become important later. Starts, breaking down food, and the stomach physically churns it, and then it'll empty into the first part of the small intestine. And then this small intestine is several feet long, and the small intestine's job is to really further not just break down food nutrients, because in the first part, the pancreas and the gallbladder actually spit out its extra digestive help. The gallbladder spits out bile, and the pancreas spits out pancreatic enzymes, which further help break down food nutrients. Then as the food travels through the small intestine, its main job is to absorb the nutrients from it. right? And then once food hits the colon, it's still liquid at that point, and then we all know that as it goes around, it will the colon will absorb more liquid from it, and it will become solid, and that's what stool is made of. So some of those things are going to become important later in the explanation. You know this though, Jen.
Yeah.
So what happens in SIBO with the small intestinal bacterial overgrowth is bacteria get overgrown in levels in the small intestine that aren't normally there. So you start to get symptoms very commonly like abdominal bloating, of course, gas. And sometimes the gas will be trapped, and then you'll just have stomach rumbles, is how people
Yeah, that's what I have. Yeah.
Right. But sometimes it can also come up and out, like belching, burping, and sometimes it can go out, as far as flatulence on the other end too.
Right.
So that's very common, but there's two, types of SIBO. There's a diarrhea dominant kind and a constipation dominant kind, and people can also float, in between the two. So diarrhea and constipation are other common bowel symptoms, but those are the common ones, and those are the ones that people think about all the time. The bloating, either constipation or diarrhea, but it really can present with all kinds of other abdominal pains and sensations. And it can also present with symptoms outside of the GI tract. It's very common to have, fatigue, a decrease in energy levels. It's really common to have brain fog, like unclear thinking. You can even have, skin rashes, and you could have muscle aches, joint pains. There's a whole host of things that can happen outside of, just gut symptoms.
And is part of that from not being able to absorb certain nutrients? Is that?
Yeah.
Okay.
Absolutely. That is absolutely part of it. And typically, besides, having a positive SIBO test, which is a breath test, which we'll talk about in a second, very commonly see on labs, people will have multiple, nutrient deficiencies. And it's because, part of the small intestine's job is to absorb the food nutrients. Well, if there's bacteria that are overgrown in there, they're stealing, the nutrients that are meant for you. Just the bacteria are growing more and more.
And I know with my blood test, that's one of the reasons you were like, yep, I'm pretty sure you have SIBO, because we looked at my blood test, and even though I doubled the amount of vitamin D I was taking, my level went down. And I was like, I am taking my supplements, I swear, and so that was really shocking to me to see that. So that was weird. I didn't, it's not a good feeling when you're eating healthy and you're taking the supplements you need to, but your body's not absorbing some of that. It's frustrating. So anyway, great. That's great. And what causes SIBO? And I know this is not a simple question.
Right. No worries. Yeah. So it's Pandora's box we're going to open here, Jen. But yeah, so that the reason I went through that little digestive thing at the beginning, because some of those have to do with the root causes of SIBO. So one of the most common causes of SIBO is people that are on or that have been on for a long period of time acid blocking medications, right? Because remember I described the stomach, it secretes hydrochloric acid, which helps break down food nutrients. So if there's no acid in the stomach, food nutrients don't get broken down properly. That when they hit the small intestine, two things happen. One, you're really not going to absorb the nutrients properly. Two, you're going to create some inflammation because there's these bigger non-broken down food particles that are bumping up against the small intestinal wall. So that's a significant issue. And then, of course, if you're not breaking down and absorbing your food nutrients properly, it's the bacteria, the small amount of bacteria that are there, then it's kind of like a feeding ground for them. So then, then allows those bacteria to grow. So acid blocking medications or not having enough stomach acid, which can happen from other reasons too. Actually, as we age, like the elderly population, they do make less hydrochloric acid. That can be an issue. Sometimes if someone has a chronic gastritis and inflammation of the stomach, you can make less stomach acid. So stomach acid, not enough of it is one big root cause. Another huge root cause are people that have been on multiple courses of antibiotics in the past. And that's because anytime you take a prescription antibiotic, it's meant to kill the infection that you have, but it doesn't just kill that infection. We all think of it as going right to the source of why we're taking the antibiotic, but it totally kills bacteria in all other parts of the body. And our gut bacteria, our microbiome, it makes up more cells than we have in our human being, which is crazy to think about, but true. And so the gut bacteria that we have, the healthy gut bacteria, we want to maintain it and protect it. When you take the antibiotics, what you do is you actually not only decrease the total number of healthy gut bacteria, but you can decrease just certain ones of them, and that allows for others to flourish and create problems. And the same thing can happen in the small intestine, of course. So now I've got acid blocking medications and antibiotics. Those are huge ones. People that have been on steroids long term, and same thing, because it will, thin the lining of the gut wall, thin the lining of the stomach. Very commonly, people are placed on acid blocking medications while they're on steroids too. But also chronic constipation. So not having a daily bowel movement is a huge risk factor for SIBO, because, as I was telling you about how digestion occurs, if, food's sitting in the small intestine for longer, think about what happens to food when you leave it out, right? It's going to ferment and grow bacteria. So all that's happening in the small intestine if it's not moving through as fast as it should be. And then the last kind of cause could be, actually there's two, one could be anatomical, as in if it has been surgery in the area that connects the small intestine to the large intestine, it's called the ileum, then that can allow bacteria to kind of freely reflux back from this large intestine into the small intestine. And if you have had a chronic infection of some kind, or sometimes even an acute infection, like if you got a really bad gastroenteritis, sometimes that's enough to tip the scale and imbalance the bacteria that just can't get quite back on track. So those are kind of the known causes for SIBO.
And I want to point something out, because I didn't find out about this until probably the last year or so, but I think part of my cause is low stomach acid and taking PPI drugs. I used to take, when I was at my heaviest of 358, I got really bad heartburn and acid reflux, mainly because I think being so heavy, but also the types of foods I was eating were causing that. And so I used to take Pepcid Max daily, sometimes twice a day, to prevent that. And I was doing that almost every day for a handful of months. And what I think is interesting about that is a lot of traditional medicine doctors because I did go to my doctor, and say that I had acid reflux, and they wanted to put me on Nexium, which I actually ended up having a bad reaction to. So that's why I stuck with Pepcid Max. But anyway, when you tell them that, they do try to treat the symptoms. But what I found out just not too long ago is that those drugs do the opposite of what you need, which the reason that I was getting acid reflux and heartburn is because I actually had low stomach acid. And so those PPI drugs make your stomach acid even lower, which alleviates the symptoms, but it doesn't treat the root cause. And so really one thing you can do, I'm not a doctor, but what I did was I started taking betaine, HCl with Pepcid to help get that stomach acid, more stomach acid. And that has really, I think, helped me a lot. I wish I would have known that a few years ago, and I would have taken that instead of taking Pepcid. I didn't realize all the problems that PPI drugs can cause.
Right. So ironically, not enough stomach acid is actually a stimulus for that sphincter, the muscle between the esophagus and the stomach, to open up. And then so whatever you do have in your stomach is more likely to reflux up. So, that's a very common cause of acid reflux. And so are food sensitivities, right? And so, that's kind of pretty much missing in traditional medicine. They might say, just avoid, eating very large meals and avoid, spicy things. But
that's exactly what they told me.
Yeah, right? I know. Yeah. But really, the top two food categories that cause problems for acid reflux are the grain family and the sugar family. And so it's infinite, actually, the number of possibilities of food sensitivities as far as creating acid reflux. But those are the top two things. Yeah.
And I'm getting kind of sidetracked here, but we talk about low stomach acid. I just wanted to ask you, we were talking about some of the causes of low stomach acid. And I was wanting to ask you if poor eating habits, could that also be a cause of low stomach acid, or is that not a cause?
It can be kind of secondarily, especially if the poor eating causes inflammation. And then that kind of chronic inflammation can, certainly cause the cells to not make as much stomach acid, the proton pumps to not pump out as much acid as they need to.
Okay, thank you. I was curious about that. So now, again, Pandora's box. How do you treat SIBO? And what is the expected recovery time? And one thing I'll say quickly is that, I didn't know much about SIBO when I was diagnosed by you with SIBO. And, a lot of times we kind of hope that it's a quick fix, like, oh, I just take a pill and like everything will be better. And unfortunately, it's not like that with SIBO. So now I'll hand it over to you for you to talk about how to treat it.
Yep. So I think it's really important too to get an accurate, diagnosis of SIBO. And so the only tried and true way to test for it is what's called a breath test. It's an easy test to do, but it's kind of a pain in the butt, right, Jen? Because it's a 3 hours of breathing into these little tubes after you drink this lactulose sugar solution. And basically what the test is doing is it's collecting two gases. It's collecting hydrogen gas and methane gas. And remember how I said there's two types of SIBO. There's diarrhea dominant and constipation dominant. Typically, if hydrogen producing bacteria are overgrown, you're more likely to have diarrhea symptoms. And if methane producing bacteria are overgrown, you're more likely to have constipation symptoms. Now, I can tell you from clinical practice, it doesn't always turn out exactly perfect like that, but typically, so the breath test is looking at levels of hydrogen and methane, how high they are and how fast they rise. And that will give me an indication as to, is it hydrogen or methane dominant? And, how bad is it? And that gives us the best kind of estimate to start doing a treatment plan. Now, I will say, the SIBO breath test, it's more likely to have a false positive than it is a false negative, meaning if your test is negative, you can be pretty sure it's negative. If anything, it may lead toward a false positive side, meaning like more, it's more likely to have a positive test if you don't have SIBO. But now with the way that tests are interpreted, it's pretty easy to rule that out. And it's also, pretty easy to follow the prep guidelines really well, which decreases the false positives tremendously. You can attest to having a pretty boring, bland diet the day before.
I hate that diet, but it makes me appreciate my normal diet more, but it is just one day, thankfully. I kind of just like tell myself, you can make it. But yeah, it's very specific. I can only eat and drink certain things, very bland, like you're saying. And also certain supplements you can't take a few days beforehand, probiotics, I think possibly magnesium. I forget what the other one is, but yeah, I have to follow all of that. But and I do, just to be clear for people who don't know about a breath test, you can go into some doctor's offices and do a breath test, but there's also an at-home breath test, which is what I do. Unfortunately, a lot of insurance companies don't cover that, or it's considered out of network. But for me, I've just decided that's easier, and it really doesn't cost too much, and the cost does get applied usually to out-of-network, or part of the cost gets applied to out-of-network. Yeah. But I know a lot of people have talked about that, but sorry, go ahead.
No, I was going to say the tests are typically less than $200 to do a home test. And you can't, like, as you mentioned, you can do them at some GI doctors' offices. Depending on how they do it, what I found is that some GI doctors won't look at hydrogen and methane. They'll only look at hydrogen, or they don't use lactulose as the substrate. They may just use glucose, which will get the first part of the small intestine basically, but doesn't look at the whole intestine. So there's all kinds of caveats when it comes to, SIBO breath testing, but that right now is the only, way to really test for SIBO. And then once you get the test results, then like I was mentioning, it can give me an idea of like how long to treat and how significant the disease is. But with treatment, it's always a guess. It's an educated guess, but it's always a guess. And that's one of the most frustrating things, right, Jen? It's, as on the doctor side and on the patient side, it's because there's no way to do a culture of the small intestine that's accurate. They've tried. They actually did some, studies with GI docs putting scopes down, because really with a scope, you can only get to the first couple inches of the small intestine from above and the last couple inches from below, from the colon. So all of that several feet of small intestine is kind of uncharted territory. So we really don't know, what bacteria are in there, and there's no good way to biopsy it or take a culture of it.
Mm-hmm.
So it really is a guess as far as treatment. Because if you had an infection, on your arm, we could take a swab and go, oh, hey, slap it down in a culture plate and look at it's staph bacteria and it's, sensitive to a penicillin drug. That doesn't exist with SIBO. So our best guess is looking at whether it's hydrogen or methane dominant. And there are multiple different treatment protocols to tackle SIBO. And there's really three main categories for us to talk about, right? There's, the traditional antibiotics, which is typically consists of something called rifaximin. And it's an antibiotic, but it doesn't get absorbed in the rest of the body. So it really kind of only works in the GI tract. And that's what traditional GI docs will do for people that have SIBO, that they diagnose with SIBO, is a 2-week course of, what's called rifaximin. And sometimes this is covered by insurance and sometimes it's not. And cash pay, it's usually thousands of dollars. And if you just do that and nothing else, the cure rate is about 50%. So it's not great. So I pretty much will never do just rifaximin by itself. But traditional treatment, if you do 2 weeks of rifaximin, what I would do is I add a second antibiotic in, depending on whether you're hydrogen or methane dominant. And then on top of that, there's at least 3 supplements that I will add that will get the cure rate up higher. So that's the shortest, treatment protocol, right?
Yeah.
And then there's a complete herbal antimicrobial protocol, meaning, taking a combination of supplements and herbs that are well studied to help decrease SIBO. And it's a lot longer of a treatment course. The shortest course would be 4 weeks, but usually it's more like 8 to 12 weeks, depending on how high the hydrogen and methane levels are. So that's an undertaking, right? So now you're talking about a month, 2 months, 3 months of treatment. But, certain protocols have touted up to an 87% cure rate. So that's a heck of a lot better than 50%.
That's just what I was going to say, that the success rate's a lot higher with the herbal treatment, for sure.
Yep, exactly. And then the third treatment option for SIBO is something called an elemental diet, which
my favorite.
Everybody's favorite. I hate the name because when you say diet, it implies that there's food involved, right?
Yeah.
Food. It's medical, these amazing medical, protein shakes. That are, specifically formulated. So no, you cannot do this with like just any protein powder. That's not what it's specifically formulated to help with SIBO and actually with inflammatory bowel disease. So if there's someone listening that has Crohn's or ulcerative colitis, sometimes the elemental diet will be used to help with those flares too. So you basically eat all of your calories for the day with nothing but those shakes. And it usually is pretty effective at helping to either cure or significantly reduce SIBO. And that is done for anywhere from 7 to 14 days on average. I've had one patient that actually did a full 28 days. And I've had cures in as short as people, kind of tapping out at 3 days and said, okay, well, let's retest and find out, how we did. But those are the basic 3 treatment options. You've got the rifaximin and or other antibiotics, which I always will mix with a partial herbal protocol.
Mm-hmm.
We've got 100% herbal protocol for anywhere from 1 to 3 months. And then we've got an elemental diet, which is anywhere from 7 to 14 days to, make any kind of headway. So those are the 3 mainstays of SIBO treatment.
And what I would tell people too, anybody who's watching this who has SIBO, who maybe has been treating their SIBO for a while, is not to give up. And I'm kind of partially talking to myself here too, because I have seen improvements. It's slow, but my symptoms are so much better now than they were a year ago, like so much better. So even though I still have it a little bit, it's much better. And so I do think it is continuously getting better. It's just taking some time. So I'm trying to be patient, follow the protocol. I know too that when I did take, how do you say?
Rifaximin, yep.
Rifaximin. When I took rifaximin and I think Flagyl maybe, with some herbal, what am I looking for? Herbal treatment as well with that. Yeah, supplements. When I did that, I actually felt really, really good while I was taking that. But then probably about a week or two later, then I started noticing symptoms again. So if anybody's watching that who's experienced that, I think it's really common for people to experience that with the prescription antibiotic, where they'll feel better on it, but then as soon as they're off, maybe a month, a couple weeks, a month or whatever, they'll start getting symptoms again. Do you find that that's the case sometimes with your patients?
Yeah. Okay, so it varies so much. Some people get really lucky, and after they do 2 weeks of a combination therapy, like their test is better and they feel better. But it is more common to have some ups and downs, and that's after SIBO treatment, no matter which one we choose to treat. You definitely need to do the low FODMAP diet for 60 days after. So after you're done killing off the SIBO, the overgrown bacteria, now you want to have a nutritional plan that's going to kind of starve them out. And so those are the FODMAPs. It stands for fermentable oligosaccharides, monosaccharides, disaccharides, and polyols. It's a mouthful. Basically, those are the things that grow bacteria. They also grow your healthy bacteria. So, because I'll have some people ask too, well, I feel great on the low FODMAP diet. Can I stay on it forever? Well, you kind of don't want to, because you want to eventually be able to foster your good, healthy microbiome that's supposed to be in your large intestine, right? So we do want to do low FODMAP for about 60 days after you're done treating SIBO, to make sure that you give yourself the best chance of not, having it come back. And then you want to slowly add one FODMAP back in at a time to figure out what things you can tolerate, because we're all going to have, some things that aren't going to go well with it. But long term, for a good, healthy gut microbiome, you are going to want the FODMAPs back in the diet. You want to, make sure that you treated the root cause of whatever got you to SIBO in the first place. So obviously, if someone's on acid blocking medications, the first step is to get them off, because there's kind of no point in treating it until they're off. It's going to come back. Avoiding multiple courses of antibiotics if at all possible, making sure you are having a daily bowel movement. If you don't treat the constipation and motility doesn't improve, your chances are high of getting SIBO back.
Okay, and I just had a question about, transitioning to like a low FODMAP diet. Should you be doing that if the SIBO test comes back negative, or just straight after the herbal treatment?
So there's two kind of camps on that. And, the latest research kind of shows that you should not go low FODMAP during treatment, because you actually want to be feeding the bacteria a little bit while you're giving the antibiotics, right? Or the antimicrobials while you're trying to kill them. You kind of want them out and about so that they can be seen and killed. Then after is the time to do low FODMAP.
Okay, and so like, let's say you do herbal treatment for however many weeks and you're feeling better, and then you should go directly to low FODMAP. But what if you get a SIBO test and it shows that you're still positive? So then you just go back to treating the SIBO again and go off the low. It's like a cycle sort of until it gets. Okay.
Like while you're waiting for test results, you want to
low FODMAP.
Right. You want to go low FODMAP because you assume you've either cured or at least made a big dent in it. And great. So if that's the case, and you want to stay low. You don't want to continue to, feed the bacteria.
Yeah.
If you did cure it, then great. You are going to stay low FODMAP for a total of 60 days anyway, and you want to just get that started. If you, have made a good dent in treatment, but need to do a second round of treatment or a third round of treatment, depending on where you're at, then as soon as the results come back, then okay, now go back to, your good, healthy, traditional, paleo or whatever you're doing for a nutrition plan, while you're doing treatment, and then you'll do your full 60 days after.
Okay, got it. Okay, so the last question is, because I'm in a few Facebook groups, and I can't believe how many people have SIBO. Like, so one of the groups has like over 25,000 people.
Wow.
And so one of the biggest questions that I see in there, which is one reason and I have this question too, is why don't many doctors know what SIBO is? I see a lot of people posting saying that their doctor, is telling them that they're not going to be able to ever feel better, or, being diagnosed with IBS or something like that.
Yeah, exactly. So GI doctors, gastroenterologists, they do know about SIBO, but pretty much like your regular primary care doctor, it's, I don't remember a word about it in medical school or any rotation that I was ever on, right? It's just not taught in traditional medicine. It's kind of one of those GI specialty things. And then there's even some GI docs that'll say, I think you might have SIBO, and they'll just give their patients a rifaximin prescription and walk out the door and hope they get better. And if not, they might try something else. But the whole, approach, the functional medicine approach is very, comprehensive. And, if you say the word functional medicine to most primary care doctors, they don't even know what it is, even though since 2014, there's been a huge Cleveland Clinic Center for Functional Medicine that's wildly successful and has over a 2,000 patient wait list. And
wow.
Dr. Mark Hyman is kind of the captain of the ship over there at the Cleveland Clinic, and he's the chairman of the Institute for Functional Medicine. So
one of my favorite people, Dr. Mark Hyman.
Yeah. So it's just an awareness thing, and as more people I think seek out alternative healthcare options because they're not getting better with traditional doctors, or they don't want to take medications, or they don't want to have a procedure, they really want to take control of their health, functional medicine is just going to continue to grow.
And honestly, I guess it's not fair to expect just a primary care doctor to know everything, because this is something a bit more specific, so you might need to go see a specialist or something. I mean, I prefer functional medicine doctor, but what I mean is, on the traditional side, it would probably be a specialist who would know. But that's what's great about functional medicine doctors. I feel like they know a lot about a lot of different stuff that it doesn't feel to be the same with a lot of primary care physicians.
Yeah, and that's like, so, I've had all the traditional training, right? And then I got trained in functional medicine. And because functional medicine is so cutting edge, like we really do keep up with all of the current research, because it takes on average 15 to 20 years from the time research proves something is effective till it gets into traditional medicine as standard of care. So we are just ahead of the curve. I'm like, for instance, I've gone to 4 conferences already this year. 4.
Wow.
Well,
amazing.
More to come.
Awesome.
And we always have to keep up with webinars and podcasts and reading, and it's a very cutting edge, exciting field of medicine that's always emerging and changing. It's very different than traditional medicine, and certainly it is a specialty on its own. And so not every functional medicine doctor knows everything about every single specialty, but there are very common things that people come to see you for, like SIBO is one of them, right? GI complaints is huge because people will get placed in this IBS box and no further workup will be done. They may be offered some traditional medications, but whether it's SIBO or whether it's
leaky gut, maybe.
Oh my gosh. I mean, the list is kind of endless. If it could be oxalates, there could be yeast overgrowth, it could be food sensitivities. I mean, on and on, right? And then autoimmune disease is another huge category that functional medicine does great with, helping with reversing, really. If you can catch autoimmune disease early enough, you can reverse it and change the course, of someone's life. They don't have to get a chronic disease. So it's really rewarding and important work, and I love it.
Yeah, and we'll have to do an interview at some point on autoimmune disease because I have Hashimoto's. So we'll have to do another interview on that at some point.
Of course, yeah, glad to.
Okay, so for people who are watching, if you think that you have SIBO or if you just want to get tested for SIBO, I highly recommend you see a functional medicine doctor. If you're in the Phoenix area, definitely check out Dr. Emily Park. So why don't you tell us how people can contact you?
Sure. So the first thing is you can go to the website. It's dremilyparke.com. So DREMILYPARKE.com. There's lots of great information on the website, all of our contact information, office phone number. I've got lots of great blogs, videos, recipes are all on the website. If you're not in the Phoenix area, you can actually go to ifm.org. It stands for Institute for Functional Medicine.org, and they actually have a certified practitioner search. So you can search for a certified functional medicine practitioner like myself in your area.
I'm so glad you said that because that's exactly how I found you. So yeah, I'm glad you said that. That's great. Okay, great. And then if you are interested in health coaching and want to learn more about how to create healthy habits, you can go to my website, which is mckeehealth.com. But thank you so much, Dr. Park. I so very much appreciate this and appreciate your time. And yeah, thank you so much.